Babies who are exposed to addictive opiate drugs while in the mother's womb experience a group of problems when born. This is known as neonatal abstinence syndrome. I went into the neonatal intensive care unit to better understand the struggles that lie ahead for these families. The following babies shown are not diagnosed. In 2016 at UP Health Systems Marquette, 74 babies were diagnosed with NAS, averaging around 30%. In the womb, the babies were exposed to prescribed drugs such as anti-anxiety pills or off-the-street drugs such as opioids, marijuana, and heroin. It is very common the drugs were also paired with tobacco use.
All of those drugs baby is exposed to in small amounts while the mom is pregnant, and a baby will withdraw from those medications. They're unable to coordinate, suck, swallow, breathe because neurologically they're disorganized because they don't have that medication that's kept them calm as that's kept mom calm, whether it's prescribed or if a mom has an addiction problem, she needs that medication to keep her life her normal.
NAS causes a plethora of problems for babies, from increased irritability, tremors, and stiffness. It disrupts their GI system, making feeding intolerable for newborns, leading to weight loss, throwing up, and diarrhea, causing skin breakdown. Symptoms are typically shown within 24 to 48 hours. The next step is determining treatment through a Finnegan scoring system. The system uses numbers based off of observing neurological behaviors. If a baby scores higher than an 8, the hospital begins treatment.
Our first line of medication that we use to treat them is called methadone, and we administer that to babies based on their weight in kilograms, and it's usually twice a day. What we try to do before we start any kind of medication, though, is do some non-pharmacologic interventions.
Locally, some babies have needed up to 6 months to wean off the medications. If provided with an appropriate plan, on average it takes 17 days until a baby is discharged. Before treatment through medication, other interventions include swaddling the baby, small feeding of low lactose formula, and breastfeeding. Although breastfeeding is encouraged, caution is taken for mothers who are not prescribed medication during pregnancy.
We try not to burden a mom who's trying to go through an addiction program, who's trying to get herself better with giving a medication that is potentially a synthetic opioid that she could take too. So we have to find someone who is capable of giving that medication to the baby that doesn't have a history of substance use or substance abuse or treatment, because that's not fair to the family who's trying to get better and work a program.
NAS leaves long-term effects for children with noticeably different tone, physical therapy, and adjusting to life outside the NICU appropriately. Children will need to attend lifelong ongoing follow-up. According to the American Academy of Pediatrics, lifelong effects can show signs of hyperactivity, attention disorders, and growth issues. Studies also show higher rates of delinquency, criminal behavior, and substance abuse.
We are not there to judge them. We're there to treat their baby. We're there to treat their baby appropriately and get them over the hump and get them through the signs and symptoms of withdrawal that they're experiencing. So we have to address all of the drugs or all of the substances that babies have been exposed to. And our job is easier if we know exactly what substances the baby has been exposed to, so we know when to watch for those signs and symptoms of withdrawal, because not every baby withdraws in 24 hours.
Corinne said for the most part, babies get through withdrawal better and faster with parents that are involved. Reporting in Marquette for ABC 10 in the CW5, I'm Lauren Lee.